your health, your story. Let's make it extraordinary. Hi, I'm Dr. Manasa Reddy. Today we have Dr. Mahaboop Shahnawaz Garu with us, and he is hearing specialist and speech therapist. Hello, sir. How are you, sir?
Fine, doing well. Thank you, Dr. Manasa, for giving us the opportunity for our viewers to view upon this program.
Thank you so much, sir. So let's talk about tinnitus, sir. What is tinnitus?
Actually, tinnitus is a very overwhelming disorder which has been there for centuries, which has not been properly diagnosed and properly understood. It is actually a sound in the ear without any external sound. Now, when we talk, we hear an external sound. But tinnitus is such a factor that the sound originates inside the head without any external sound. That is called phantom tinnitus or tinnitus sound.
Okay.
And it varies across different frequencies for different individuals and different people.
How do they experience?
People who have tinnitus, the experience is very bad because when you have a sound inside the ear, the head is considered as a closed room, is a chamber-like.
Okay.
So when it is a chamber-like, then any sound coming inside the ear is traumatizing. Suppose you have a AC running in the house. If the normal sound of the AC is there, you tolerate it. But suddenly if the AC makes some abnormal sound, you are not able to tolerate for a few minutes. So if this abnormal sound is going inside the ear, imagine the trauma. So sometimes it starts with one ear, then it goes to the second ear, then it goes to the center of the head.
Okay.
When this happens, the patient experiences destabilizing condition. Some have even tendency of suicidal and high depression.
Okay.
And especially nowadays, the work is oriented towards computers and closed rooms and office spaces, where it is very difficult for a person who has a noise in the ear called tinnitus to be experiencing on a day-to-day basis.
So why do some people develop tinnitus with very normal hearing also?
Yes, formerly it was thought that the ear is responsible for tinnitus. And most of the hearing testing that are taking place are being tested at certain frequencies from 250, 500, 1000, 2000, 4000, 6000 and 8000 hertz. But to a large extent, some people who have normal hearing may have minimal hearing loss in the very high frequencies which are not routinely being tested. That is number one. Number two, there is an idiopathic condition where without any reason a person can develop tinnitus.
Okay.
So the concept of people developing because of a ear problem is not very significant now, because the tinnitus is experienced at the auditory cortex level, that is the brain region. That is one of the points why even normal hearing people do have tinnitus. The second thing is people who have hearing loss, they tend to have also tinnitus, and that can be explained that because they have a hearing loss. So both the theories do exist at the modern times.